Hello everybody, it's Coach Erica and I'm here to talk to you about shoulder impingement. I think it's a very common thing that happens when we're working out, and for you to understand what's actually happening in your shoulder, I think it will help you with positioning and such when you're working out so that you don't keep injuring your shoulder. So when you talk about the shoulder in general, it is actually compromised. It's made up with 3 different bones, okay? So this model here is a bit of a better model because it's going to show all of the 3 bones that make up the actual shoulder joint itself. The first bone is your collarbone, okay? And then you have your humerus, that's your arm, and then your scapula, okay? That actually sits on the back side. So this is what it looks like if it was on a person, all right? So when these bones do not work together, sometimes we experience this shoulder problem called impingement. It's very common that a doctor will give you a diagnosis of rotator cuff impingement syndrome, bursitis, or all of the above. So basically a tendonitis also. So when we move our arm over shoulder height, or we reach in front of us or out to the side, you can see that the head of the humerus is actually gliding and rolling down. So when you lift up, see how that goes down like that and comes up. So the problem is when we do that and we don't have a balance of muscle tissue around the actual joint itself, we can cause impingement. And a fancy word, impingement, just means pinching of the tendons. So our shoulder has a rotator cuff, which is compromised. It means 4 muscles are involved, and the most common one here is this one right up here. It's called your supraspinatus muscle. When we all think of muscles of the shoulder, we're all very well aware of our upper trapezius. Well, this muscle lies just directly below that. So if you took the trapezius off and you look just at the shoulder itself, that muscle lies in the supraspinatus fossa of the scapula, and it runs underneath the acromion, which is also part of the scapula, comes around like this, so it goes underneath there, and then it inserts on the front of the humerus. So when we lift our arm up overhead, if that muscle, as it becomes a tendon before it inserts on the humerus, is being pinched in there, it can cause all sorts of pain in the shoulder, okay? Another couple muscles that are part of the rotator cuff are 2 that lie here. One is the infraspinatus, so it's coming around also, forming a cuff around that humerus. And the third is the teres minor. And then underneath here is the subscapula. So that's actually on the back side of the scapula between your rib cage and the scapula itself. And that comes around the front and helps form the cuff. So if you think about it, there's 3 muscles that insert around the side of the shoulder and 1 in the undersurface. And those 4 muscles make up the rotator cuff. So when we think about impingement, a lot of times when I evaluate somebody and they lift their arm overhead, the side that is bothering them goes like that for them to try to reach full motion. So what's happening is the muscles that help pull the head of the humerus down and allow it to glide, they're not working properly. So then as you lift your arm overhead, it sucks up and causes this pinching feeling and quite a bit of pain. So in order to avoid pinching when you're working out, if you're doing arm raises, best to have the thumb up anytime you go over shoulder height, okay? So when we're doing arm raises with the arm lifts with the arms neutral, or the forearms down, that's okay because it strengthens your deltoid, or that front cuff muscle. But when we go thumbs up and we reach over shoulder height, we're actually strengthening our proximal bicep tendon, which also is involved in impingement too, because that comes up in the bicipital groove and it inserts on the capsule of the actual shoulder. So that can also be pinched with the rotator cuff muscle. So we want to make sure we're doing thumb up so that we're not pinching. Watch this. If I go like this, palms down and lift overhead, see my range of motion? The second I turn my thumb and reach, I gain about 20 more degrees of range of motion. So anatomically, we are made to reach for things with our thumb up. So why would we strengthen past shoulder height with our thumb in neutral position. We shouldn't be, okay? So when we're doing military press, we should have that neutral forearm position. When we're doing raises beyond shoulder height, thumb up, okay? It's fine to do front raises, but we need to be able to stop them at shoulder height. Lateral raises, same thing. If we're strengthening here, that's fine. If we're going above shoulder height, again, thumbs need to be up so that they're coming in like so. And that's going to prevent further impingement syndrome. Now, to create that muscle balance, we have a bunch of muscles that are inside the scapular region. So just like I explained to you before, that the head of the humerus has to glide down to come up. So what muscles are allowing that glide down? That's a great question. Latissimus dorsi, lat pull downs. I'm sure a bunch of you have always heard of that. Your triceps are helping. So if we're constantly building that bicep muscle, but we forget about that tricep extension, or we forget about shoulder extension going straight back like this, right? Think about swimmer muscles. We do those a lot with the skiers, so that's helping with preventative. And then also anything where you are pulling your shoulder blade in. So we live in this world where everything's in front of us. Things are tightening in the front, including adaptive shortening of our pec muscles, right? So this is an exaggeration, but if you're trying to improve your shoulder mechanics, you got to get out of these faulty postures and get things stretched here and strengthened back there. That's where the rows come into play, right? Whether we're using the skiers, the TRX, bent over rows, rows are excellent, pull downs are great, and triceps, we want to keep them as strong as the biceps, okay? But we can never forget about those little rotation muscles of rotator cuff, because over time, just like the hips, those rotation muscles are the little muscles with big impact, okay? So whenever you have a question about exercise and form, don't feel bad about it. That's why we're here. We don't want you to get injured while you're working out. We just want to keep you strong. We want to keep things balanced in between the musculature of the entire shoulder blade, scapular region, and the humerus, and get that thing pulled down. I do have a picture here of all the muscles that I've been talking about. So if you look here, that's your supraspinatus, your infraspinatus, and your teres minor, right? So they come around, and those three muscles help form the cuff. On the inside here, when we're doing rows, we're working on the middle traps, which we all overuse our upper traps from just stress. So it's great to strengthen here to also help create that middle, that muscular balance, along with the rhomboids. So they are underneath. If this is reflected, that's what you're looking at here. And the low traps, okay? And then see this enormous muscle right here that originates in the back? It comes up and actually inserts in the bicipital groove in the front of the shoulder. So your lat muscles are one of the biggest muscle groups in the body, and it's very important to strengthen that to help with the shoulder mechanics, that depression of the shoulder, so it doesn't pinch when we're working over shoulder height. Okay, so that's a lot to digest, I understand. And I am a physical therapist, so I'm all about biomechanics, muscle balance, and correcting things if they're wrong. But hopefully you learned something from this, and you will understand why we do what we do on a regular basis. So have a nice snowy day. I came to work, got a couple cancels, but here I am educating you, so it's a win-win. Have a wonderful day, and I'll see you in your next session. Bye, everybody.